Good morning. My name is Christine Hill. I'm a registered nurse working for Villa Healthcare at the Monroeville location. I have been asked by management at the South Hills Villa location to reflect on an incident in which I utilized interdisciplinary collaboration to successfully solve a problematic issue within my unit. The purpose of this presentation is to provide the South Hills location with the skills necessary to incorporate interdisciplinary collaboration to help rectify the issue they are having with their computer system and their staff. During this presentation, I will reflect on my experience and discuss ways in which it was successful and things I could have done differently to achieve my desired outcome. I will identify ways in which poor collaboration have detrimental effects on the nursing profession and how it can also have significant financial ramifications. I will also identify best practice strategies that will help improve the team's ability to achieve their goals and how to work more effectively together. The story I'm about to share describes an issue that was affecting staff retention and morale on my unit. I work in a perioperative area and have been employed there over 10 years. This had been a wonderful place to work and there was rarely new positions posted. Nurses waited for years to get in. Recently, there has been a high turnover rate and morale throughout the unit has been at an all-time low. The main cause of this was due to incivility and bullying. I am, for the most part, a happy and pleasant individual and am very easy to get along with, but a certain group of individuals, including the unit manager, made it hard for me. Many nurses tolerated the abuse because they were afraid to step forward and tell somebody about it. Several nurses had reported bullying incidents to the unit manager and nothing seemed to have changed. One day, I was verbally assaulted by a fellow employee in front of patients, staff, and doctors. This event was totally unprofessional and made me feel embarrassed and incompetent. I could not tolerate this kind of abuse any longer. I reported the incident to my manager and waited 2 weeks for something to be done. Nothing happened, so I went to Human Resources. After discussing the issue with Human Resources, I soon discovered it was not only unit-specific, but a problem that could potentially affect the entire facility. My goal was to find a potential solution that would create a safe and productive work environment throughout the entire facility. After several meetings with HR, we put together an interdisciplinary team that included staff from all disciplines to work on the solution because all members of the healthcare team, from upper management down to the ancillary staff, are responsible for creating a safe work environment. Evidence shows that when all disciplinary teams are involved in the problem-solving process, the outcomes are more successful. As stated by the article, Incivility, Bullying, and Workplace Violence, put out by the American Nurses Association, which I will refer to as the ANA. They stated, when all staff are asked for input, it ensures that staff co-owns the process and expectations. The ANA also suggests that all RNs and relative healthcare professionals must collaborate to create a culture of respect that is free from incivility, bullying, and workplace violence. After collaborating, the team decided to use the Plan, Do, Study, Act model, which I will refer to as the PDSA model, to come up with the best solution. According to the ANA, the PDSA provides a framework for developing, testing, and implementing changes leading to improvements. It is based on the scientific method. In the planning stage, we decided we wanted to create a safe and healthy work environment that promotes physical and psychological well-being, as well as an environment that promotes open communication, teamwork, respect, and dignity. From the plan stage, we moved on to the do phase. During the do phase, we created new policies and procedures that initiated a zero tolerance against incivility. We incorporated these new policies and procedures into a mandatory orientation for new employees as well as existing employees. We also provided a safe way for employees to report the abuse through a no retaliation effort. After that, we established a team steps approach, which taught our employees how to de-escalate situations. Team Steps is an evidence-based program developed to advance teamwork and communication among healthcare workers. We then continued to the study phase, which consisted of the stakeholders reviewing the steps and programs we had devised. We also made note that without this plan, incivility could have detrimental effects on the nursing profession and huge financial ramifications for the facility as well. According to Ellen Fink's Samsick's article, The Side Effects of Workplace Bullying, incivility causes decreased job satisfaction, has decreased effects on personal health, plus puts patient safety in jeopardy because of communication breakdown, and is one of the top reasons nurses leave the profession. The institution also suffers financially. The same study has shown that the financial losses are due to training new nurses to replace the ones that have lost, recruiting and hiring new staff, decreased productivity, and cost to supervise the uncivil employee. Through the act phase, the plan was put into motion. However, we do not know the outcome, if it was successful or not, because time has not passed. A successful outcome would be a safe and healthy work environment and would include a lower RN turnover rate. Interdisciplinary collaboration is a necessary part for any organization. Upper management of the South Hills Villa location failed to include the opinions of the staff who will be using the computer system. This breakdown in communication led to staff becoming frustrated because the system did not meet their needs in the clinical setting. Ultimately, the facility suffered a financial loss due to decreased productivity, putting patient safety in jeopardy, medication errors, decreased employee retention, and these were just to name a few. With teamwork and collaboration, all of this could have been avoided. This was a costly lesson for the team to learn. I want to thank you for letting me share my experiences with you and hope this presentation will help you with future problems or changes your organization may have. Thank you and have a nice day.